This is a very important class of midwifery where we will discuss the landmarks of fetal skull. Let us start. First of all, we should know what are the divisions of fetal skull. Fetal skull is divided into three parts: vault, base and face. The vault is large upper dome-shaped portion which lies above the imaginary line drawn between the orbital ridge and the nape of the neck. So this is imaginary line, and starting from this point, this is vault. Then second part is base, comprises of bones that are firmly united to protect the vital centers in medulla oblongata. This part is base, and the face is composed of 14 small bones that are also firmly united and no compressible. This is non-compressible. So basically you should know that the vault is compressible during delivery while face and base are not compressible. Next, we should know the bones of vault. The bones of vault are laid down in membrane. Okay, so initially in embryo there are membranes, and through ossification center the bones become ossified. But even just before birth the bones are not fully ossified. So there will be membranous structure in between, and this help in molding during delivery. They are hardened from the center to outwards, and this process is known as ossification. Ossification is incomplete at birth, leaving small gap between the bones here. These are known as sutures and fontanelles. The bones of vault consist of number 1, occipital bone posteriorly, which lies at the back of the head. This one. The part of it contribute to the base of the skull, means it's some part which lies below it from the base, and then it forms the part of vault. The part which makes or forms the base contains a hole known as foramen magnum, which protects spinal cord as it comes out of the skull. The ossification center of occipital bone is occipital protuberance. Okay, it will be posterior here. You can feel also. Then two parietal bones are there, which lies each on either side. Okay, so in this skull you can see these are parietal bones. Then two frontal bones. Here you can arise or ask a question that frontal bone is one, why there are two? Actually, just before birth the bones are separate, frontal bones are separate and they are two, but after delivery they fuse to each other and form one bone. So in fetal skull there are two frontal bones. Two frontal bones which form the forehead, or also known as sinciput. The frontal bone fuse into a single bone by the 8 years of age. The upper part of two temporal bone which lies here, the upper portion of these temporal bone take part in formation of vault. Now we will discuss about sutures and fontanelles of fetal skull. What are sutures? They are cranial joints formed where two bones meet. So these are joints, this one, this one, this one. So these are known as sutures. And what are fontanelles? It is formed when two or more sutures meet. So these are the fontanelles, this one and this one. And what is molding? The sutures and fontanelles described above permit a degree of overlapping at the time of delivery, and this is known as molding process. Now, what are the sutures in fetal skull? Number 1, lambdoidal suture. It separates the occipital bone from the two parietal bones. So this one is occipital and these two parietal bones. So in between them, this is lambdoidal suture. And what is sagittal suture? It lies between two parietal bones. So at center there will be sagittal suture, and then coronal suture. It separates frontal bone from the parietal bone, passing from one temple to another. Okay, in this way. So here in this picture you can see this is coronal suture, and then last is frontal suture. It runs between the halves of two frontal bones. So this between the two frontal bones there will be frontal suture. Then there are two fontanelles. One is posterior and one is anterior. So this is posterior fontanelle. The posterior fontanelle or lambda, it is also known as lambda because it's shaped like Greek letter lambda. It is situated at the junction of lambdoidal and sagittal suture. So this is sagittal suture, this is lambdoidal suture, and at the meeting point there will be posterior fontanelle or lambda. It is small, triangular in shape that can be recognized vaginally because the suture leave from each of the three angles. So this is triangular, and during PV examination we can find or we can feel if there is vertex presentation. If it is triangular, then it means it will be posterior fontanelle. Normally posterior fontanelle closes at the age of 6 weeks. Then anterior fontanelle or bregma. This one is known as bregma. It is diamond shaped. It is broad, kite shaped. Okay, kite or diamond. It is recognizable vaginally. Again, if there is when we do PV examination, if we feel kite like shape, then we can understand that this is anterior fontanelle. It measures 3 to 4 centimeter long and 1.5 to 2 centimeter broad. It closes normally by the age of 18 months. Now, regions and landmarks of fetal skull. The fetal skull is further separated into regions, and within these there are important landmarks. So first region we will see. Before this, we can understand why these landmarks are important, because these landmarks are useful for the midwives when undertaking vaginal examination or PV examination, as they help to ascertain the position of fetal head. Okay, we can feel. The first region is occiput region. Occiput region lies between foramen magnum and posterior fontanelle. So this one is occiput region. Posteriorly, the part below the occipital protuberance, this one, this is a landmark, and the part below it is known as suboccipital region. The vertex region. Vertex region starts from the posterior fontanelle and two parietal eminences and then two anterior fontanelle. So the place between anterior and posterior fontanelle and two parietal eminence, this is known as vertex region. Then there will be third one, forehead or sinciput region. This region extends from the anterior fontanelle to coronal suture. Anterior fontanelle, coronal suture, and up to the orbital ridge. So this whole place is known as, or region is known as, forehead or sinciput. The face, it will be below this, extend from the orbital ridge to the root of orbital ridge or root of the nose, and then up to chin. Chin is also known as mentum. This is a landmark. And the neck. The point between eyebrows here this will be known as glabella. So this is also a landmark. Now we will discuss about diameters of fetal skull. These diameters are very important because this will explain how the fetus come out of the pelvic cavity. The knowledge of diameter of fetal skull along with the diameters of pelvis allow the midwife to determine the relationship between fetal head and mother's pelvis. There are 6 longitudinal diameters and 2 transverse diameters. So total 8 diameters we will discuss here, 6 longitudinal and 2 transverse. So first longitudinal diameter is the suboccipito-bregmatic diameter, which is 9.5 centimeter, measured from below the occipital protuberance to the center of anterior fontanelle or bregma. So this one is suboccipito-bregmatic diameter. Then suboccipito-frontal diameter, it is 10 centimeter. It is measured from below the occipital protuberance to the center of frontal suture. So this one is suboccipito-frontal frontal diameter. It is 10 centimeter. Then occipitofrontal. Occipitofrontal is 11.5 centimeter diameter and measured from the occipital protuberance to glabella. So this is 11.5 centimeter. Then mentovertical. Mentovertical diameter is 13.5 centimeter, measured from the point of chin. This is mentum to the vertex. Okay. So this is mentovertical diameter. It will be 13.5 to 14 centimeter. Then submentovertical. Submentovertical diameter measured from the point where chin joins the neck. So in between this there will be submental portion and up to the vertex, highest point on the vertex. So this one is submentovertical, which is 11.5 centimeter. Then submentobregmatic, 9.5 centimeter. It is measured from the point where chin and neck join here again and then up to bregma. Okay, so this is submentobregmatic diameter. Then 2 transverse diameters will be there. One is biparietal diameter, the diameter between 2 parietal eminence. Okay, the diameter between 2 parietal eminence, this will be biparietal diameter, and bitemporal diameter between the temples. Okay, the diameter between 2 farthest posts of the coronal suture. तो coronal suture के यहाँ पर जो place होगा, that will be the bitemporal diameters. Okay. Now diameters of fetal trunk. Actually we are discussing fetal skull, but still in midwifery we should know 2 more diameters, that are diameter of fetal trunk. One is biacromial diameter, which is 12 centimeter. This is between the distance between the acromion process, okay, of the shoulders. This one. So here you can see this is biacromial diameter, which is 12 centimeter, and then there will be another diameter of trunk by trochanteric diameter. Okay. So the articulation of clavicle and sternum allow the forward movement of the shoulders, and this can reduce the biacromial diameter slightly. By trochanteric diameter between the trochanters here of the femur, it is 10 centimeter, and this is measured between greater trochanters of the femur and is the presenting diameter in breech presentation. Okay. Now presenting diameter. What are the presenting diameters? The presenting diameters of the head are those that are at right angle of the curve of cars. Okay, at the curve of cars at the time of engagement, so 2 diameters will be there. Okay, so these will be known as the presenting diameters. One will be longitudinal diameter and one will be transverse diameter. The presenting diameter determines the presentation of fetal head. Some presenting diameters are more favorable than others for easy passage through the maternal pelvis, and this will depend on the attitude of the fetal head. So here question arises, what is attitude? The term attitude is used when we describe the degree of flexion or extension of fetal head like this and like this on the neck. The attitude of the head determines which diameter will present in the labor. For example, if there is a vertex presentation, in vertex presentation when the head is well flexed like this, then suboccipitobregmatic diameter and bitemporal diameter will be presented. It is the most favorable shape for dilated cervix and for birth of the head. So this is vertex presentation. And what is face presentation? When the head is completely extended like this, then the presenting diameters will be submentobregmatic and bitemporal. The submentovertical diameter will distend the vaginal orifice and help in the delivery process. Then brow presentation. In brow presentation, when the face is partially extended, not fully extended, partially extended, and mentovertical diameter and bitemporal diameter will be presenting diameters. If this presentation persists, normal vaginal birth is not possible. Caesarean section will be advised.